Meet Anderson, final year student, Dean's List, always the life of the room, at least that's what it looked like on the outside.
6 months ago, Anderson and his friends studying together. But somewhere along the way, things got heavy. He stopped sleeping, stopped replying, stopped feeling himself, and told himself it was just stress.
You haven't been to class in 2 weeks, man. Talk to me, what's going on?
Just
I'm just tired, man. Please, let me take you to see someone.
based on what you described, the low mood, burst of interest, and poor sleep for over 2 months, I'm diagnosing you with a major depressive disorder.
I thought I just feel weak.
Um, I'm prescribing you a Fluoxetine. It's going to help.
That small piece of paper changed Anderson's life, but what exactly is fluoxetine? What does it treat? How does it work? And what does it do inside the body? That's exactly what we're here to find out. Let's start with the basics. What is this drug and why was it prescribed to Anderson?
Hi everyone, today I will explain the uses of fluoxetine and the condition it treats. Fluoxetine is an antidepressant that belongs to a group of medicine called Selective Serotonin Reuptake inhibitors. It works by increasing the level of serotonin in the brain. Serotonin is a neurotransmitter that helps us to regulate the mood, emotion, sleep, and anxiety. By increasing the serotonin level, fluoxetine helps improve mood and reduce symptoms of depression and anxiety. However, it controls symptoms and is not considered a cure for this condition. Fluoxetine is used to treat several mental health disorders. The main condition is major depressive disorder, where it helps to reduce persistent sadness and improve daily functioning. It's also used to treat obsessive compulsive disorder, helping reduce unwanted thought and repetitive behavior. In addition, fluoxetine is prescribed for panic disorder to decrease panic attack, bulimia nervosa to reduce binge eating and purging behavior, and also premenstrual dysphoric disorder, which is a severe form of premenstrual syndrome. In some cases, doctor may also prescribe for anxiety disorder when appropriate.
Now, let's talk about the pharmacodynamics of fluoxetine. Let's talk about the primary mechanism of action. Fluoxetine is an SSRI, so it works by selectively inhibiting the serotonin transporter SERT located on the presynaptic neurons in the central nervous system. For Anderson, after serotonin is released into the synaptic cleft, it's transported back into the presynaptic neuron through SERT, which is blocked by fluoxetine, which will now cause reduced reuptake of serotonin, increased serotonin concentration in the synaptic cleft, prolonged stimulation of postsynaptic serotonin receptors, enhanced serotonergic neurotransmission, and it'll improve his mood and alleviate his anxiety or depression symptoms. Fluoxetine also has a delayed therapeutic effect. So although serotonin levels will increase within hours of taking fluoxetine for Anderson, clinical improvement will usually take between 2 or 6 weeks, and this is because it's a long-term antidepressant, and its effects depend on adaptive changes in the brain, which include desensitization of presynaptic 5-HT1A autoreceptors, increased serotonin release over time, changes in gene expression and neuron signaling, and enhanced neuroplasticity and neurogenesis in the brain. Secondary pharmacodynamic effects. Fluoxetine also has mild effects on other neurotransmitter systems. So for Anderson, this may indirectly increase his dopamine and norepinephrine activity in some of his brain regions, but it'll have a relatively low affinity for muscarinic, histaminergic, or alpha-adrenergic receptors, which will cause fewer anticholinergic and sedative effects if it's compared with other or older antidepressants he was using, like amitriptyline. Now let's move on to pharmacokinetics.
So we know Anderson is been prescribed with fluoxetine. But what actually happens to the drug once it enters the system? That's pharmacokinetics. ADME: absorption, distribution, metabolism, and excretion. Let me walk you through each one. So first, Anderson will be taking the drug orally. It gets absorbed in his gut, and about 72% of it actually makes it into the bloodstream. He can take it with or without food, no problem at all. It doesn't affect the drug. And once it reaches the bloodstream, the drug is widely distributed throughout the body. And because it's highly lipophilic, it can easily dissolve in the fat layer and crosses the BBB, the blood-brain barrier. And about 94% of it binds to the protein in the blood, and only the remaining 6% of it is active. In the liver, fluoxetine is broken down by an enzyme called CYP2D6. It's broken down into norfloxetine, which is an active metabolite. So this means Anderson is basically getting two drugs from one tablet. Finally, fluoxetine and norfloxetine are eliminated through the urine. Fluoxetine has a half-life of 1 to 4 days, and norfloxetine has a half-life of 4 to 16 days, and that's enormous. This means that even after Anderson stops taking the tablet, the drug is still active in his system for weeks. It's actually a benefit because missed doses aren't as dangerous, and stopping fluoxetine causes very little withdrawal symptoms compared to other antidepressants. So that's how Anderson's body handles fluoxetine. It's absorbed well, it reaches the brain, it's converted to active metabolites, and it stays in the system for a very long time. But just like any other drugs, fluoxetine also comes with its risk. And let's hear about those in the next slides.
For this part, I'll be going through the side effects and precautions of fluoxetine. Though SSRIs are one of the safer drugs, targeting only serotonin transporters with minimal autonomic side effects, it is not completely free of side effects. Fluoxetine not only increases serotonin in the brain, but also around the body. Gastrointestinal issues like diarrhea and constipation are common, especially early on. Some patients also notice weight changes after using fluoxetine. Headaches are another frequent complaint, and drowsiness may occur, so caution must be exercised in situations like driving. Fluoxetine is known for having a bleeding risk with blood thinners. Patients taking fluoxetine must be monitored as there's a risk of suicidal thoughts, particularly in children and teens. Combining it with other serotonin medications can cause serotonin syndrome, a potentially dangerous reaction. Doctors must carefully review the patient's current medications list before prescribing, as it may potentially cause harmful drug interactions. Now that you're aware of the side effects and what precautions to take, we'll move on to the next part. Thank you.
Hi guys, for my part, I'll be discussing alternative medications and treatments and a few interesting facts about fluoxetine. So, although fluoxetine is a commonly prescribed antidepressant, it's not the only medication available for treating mental health conditions. Other medications within the same class, known as selective serotonin reuptake inhibitors, or SSRIs, include sertraline, citalopram, and paroxetine. These drugs work in a similar way by increasing serotonin levels in the brain. There are also antidepressants from different classes. For example, venlafaxine and duloxetine belong to the SNRI group and affect both serotonin and norepinephrine. Other options include bupropion and mirtazapine, which work through different mechanisms. The choice of medication depends on factors such as patient's symptoms, medical history, side effects, and response to treatment. Medication is not the only treatment option available for mental health disorders. Psychological therapies such as cognitive behavioral therapy or CBT help patients identify and change negative thought patterns. Counseling and psychotherapy can also provide emotional support and coping strategies. Lifestyle modification, including regular exercise, adequate sleep, and stress management techniques, have been shown to improve mental well being. For patients with severe depression that does not respond to medication, more advanced treatments such as electroconvulsive therapy or ECT may be considered under specialist supervision. Often, the most effective treatment plan combines medication with psychological support. One interesting fact about fluoxetine is that it was the first SSRI antidepressant to achieve widespread success in treating depression. It was introduced in 1987 under the brand name Prozac and quickly became one of the most recognized psychiatric medications worldwide. The introduction of fluoxetine changed the way depression was treated because it generally caused fewer side effects than many older antidepressants available at that time. Today, fluoxetine remains one of the most commonly prescribed antidepressants and continues to play an important role in mental health care. Another unique feature of fluoxetine is its long half-life. This means the drug and its active metabolite can remain in the body for several weeks after treatment is stopped. Fluoxetine is also used for a variety of conditions beyond depression, including obsessive-compulsive disorder, panic disorder, bulimia nervosa, and premenstrual dysphoric disorder. In addition, fluoxetine has been included on the World Health Organization's list of essential medicines, highlighting its importance and effectiveness in healthcare systems around the world. These facts demonstrate why fluoxetine remains one of the most influential and widely used antidepressants today. Thank you. Bye-bye.
From this assignment, I learned actually that fluoxetine is used to treat more than just depression. It also can help manage conditions such as OCD, panic disorder, bulimia nervosa. Researching this medication helped me to better understand this mechanism of action and the importance of using the right drug for different mental health conditions.
Before working on this assignment, I actually realized I didn't know how antidepressants actually work. I knew they had side effects, but I thought they would work really quickly or they would like instantly make the depression go away. Now though, I know that there's multiple kinds of them, how they work behind the scenes, and how they may not even work. Or some of the antidepressants don't work for other people, or the side effects are worse than the depression itself.
While working on this assignment and having learned fluoxetine in depth, it has changed my views on antidepressants. It isn't a drug that randomly cures depression anymore. I knew the pharmacodynamics behind it. I also realized how many precautions there were and how important it is to balance the medication risks and benefits to keep the patient safe.
Before this assignment, I only knew that fluoxetine was used to treat depression, but after researching it, I learned how it works in the body and how it can help people manage different mental health conditions like OCD or panic disorder. I also realized that every medication has both benefits and side effects, so treatments need to be tailored to each patient. Overall, this assignment gave me a better understanding of the role medications play in improving patients' lives and mental well-being.
Doing this assignment actually hit close to home for me. I had a friend who experienced severe burnout. She withdrew herself from everybody else and stopped doing the things she once loved doing. And eventually she was prescribed with fluoxetine. Back then, I never understood why she still seemed off even after she stopped taking the medicine. But now I understand. Seeing that fluoxetine is a really active metabolite and it stays in your body for like 16 days after the last dose, it completely changed the way I think about stopping a medication. It's never as simple as just stopping.